Healthcare is one of the most traditional industries there is. That's why disruption matters here more than anywhere else. In this podcast, we'll explore how Hogue and the disruptors around us are reimagining the future of healthcare from right here in Orange County, California, to the rest of the world. I'm fortunate to call today's guest not only a colleague, but a friend. Robert Braithwaite, Hogue's president and CEO, and I have the kind of relationship where we can be direct, disagree, and still come out stronger. That perspective is exactly what makes him a disruptor. Robert is someone who leads Hogue by challenging norms and pushing healthcare forward. In this episode, we'll discuss how he makes decisions without bureaucracy, partners with private companies to deliver new solutions, and maintains an uncompromising focus on excellence. I'd like to welcome you to our Take Me to Hogue First podcast. And perfect guest, our CEO of Hogue, Robert Braithwaite. Robert, this is going to be fun. You looking forward to this today?
I am.
Yeah, me too. I think as people get to know us a little bit, it might be helpful to understand a little bit about our backgrounds. And certainly maybe a first job. I know you have a storied background with the things you've done in the healthcare space, but maybe you could share, and I'll share also, what your first job was and how that maybe applies to what you do today.
Yeah, great. So my first job was here at Hogue. I was an intern back in 1990. And I thought when I had the opportunity to come here, I'd be working on some business projects. Actually, they assigned me to the basement of Hogue to clean surgical instruments that summer. It was a warm, challenging job. And then in the afternoon, I'd go upstairs and work on a business project with the executive team to get a little business experience.
No surprise, I mean, with that kind of background and starting at that level, I mean, you've kind of seen all aspects of Hogue. I think about my own first job, and it has a correlation to kind of my opportunity in my role at Hogue today. Whether it was working in restaurants or delivering the newspaper, the one that really stands out for me is being a lifeguard in Laguna Beach and taking care of the public and watching out for their safety and learning to communicate. And it really was kind of healthcare at the beach. So kind of an application to what we do together today for Hogue. So as we kind of take away from that internship experience, I'm curious, was that really your inspiration to what you're doing today for your profession?
You know, I always wanted to be in the healthcare space. Initially, I thought I would go off to medical school. In fact, I did get accepted to medical school, but I ended up taking a couple business classes towards the end of my undergraduate degree and really got inspired by that. I then did the internship, which taught me and showed me a little bit about being part of healthcare, but on the business side. And so I made a pivot and decided to go off and get a master's degree in healthcare administration as kind of an interim step. And so I did that, went down to Arizona, which was probably the then biggest program for managed healthcare, if you will, and loved it and returned to Hogue as the administrative resident, and I was launched.
Yeah. Well, with that launching, and if you could reflect back a bit, is there a motto that you carry with you that gets you up in the morning?
Yeah, well, early in my career, one of the things that really helped was always saying yes. So somebody came with an opportunity or a need and just saying yes to whatever that invitation was. It opened a lot of doors and it gave me a lot of opportunities that I might otherwise not have had. You know, as life has gone on, my professional career has evolved. I've kind of shifted over towards this notion of just being relentless in pursuit of what's right, what's good, what's excellent. And I think those are kind of the two things that I've followed in my entire career. Say yes, and then be relentless.
Well, both of those show clearly in your extraordinary work that you do on behalf of Hogue. And as we get into a little bit more about your role and some of the things you're doing, I think those two mantras will come full circle. I think for myself, thematically in our conversation today, you know, kind of putting others first, and kind of that role as a fiduciary, not just in the financial sense, but a fiduciary to just looking out for the community and people has always been a driver for me. So a nice similarity. And I think as we keep it more macro right now, you just reflected on the internship, you reflected on kind of the evolution of your career a bit. So is there a memorable moment that maybe pops out for you as you think about the many at Hogue, one that might come to your mind?
There have been many, which is awesome to think about. And however, there was one kind of defining moment, I think, in my career where back in 2010, September, it was the evening, September the 9th to be exact, the evening before we opened up Hoag Hospital Irvine. And we had worked relentlessly for 16 months on getting that project done. And the hospital was closed, the staff had already gone home, and they were tired and they were prepared for the great day, which was the 10th, opening day. And I remember standing in the atrium of Hoag Hospital Irvine, and I was the only one there, and it was probably 7:30 at night, looking up and just kind of realizing what a magical moment this was going to be. The amount of sacrifice that had been made by so many people in a time of the recession, very difficult and challenging economic circumstances. And I just remember thinking what the collective at Hoag had done, from the board all the way through the entire organization and through all the medical staff. What we were about to do the next day was for the common good of Orange County. And that was just a great feeling, a great moment to be alone, to kind of soak in that thought. And here we are 15 years later, having served tens of thousands of people and saved lives and changed families and done a lot of good in Orange County.
Well, I have no doubt you've got lots of career left. I have no doubt there's going to be many more magical moments for you and ones that you're going to reflect on similarly. As I share and think about the ones for me, the Hoag moments, grandsons being born at Hoag, oh my gosh, how is there a second to that? But I think the one for me that really captures the pride I have is the first board meeting that I presided over as the board chair. Oh my gosh, I think about my life's work and just the things that I've done, and being given that opportunity to have that seat and to help lead such a great organization was very, very meaningful to me.
Yeah, that was a great moment, to be sure.
Yeah, and so thank you for that opportunity, by the way.
You're welcome.
I appreciate it. I think your team is always recruiting the best talent.
That's right.
And I think about some of the recent recruits that you've had on a national basis here. It's amazing. So I think certainly the care and the nursing is so vital. Maybe you can comment a little bit on just the talent, the facilities, the continued investment in the franchise.
Yeah, well, we've always had this motto that, it's three legs of a stool. You have to have the best staff. You have to have the best facilities and technology, and you have to have the best physicians. If you get those three things right, it's a magnet for the others to work, I guess, synergistically and kind of pulls everything together. So to that end, you bet, finding the best talent, clinical talent, the best physicians across the country that truly are leading and innovating beyond the normal or beyond the expected is what we're striving for. And we've been very fortunate to be able to recruit them, introduce them to this amazing environment that's very fast, very nimble, very warm, and they see a difference, and they come, which is great.
I mean, there's certainly a lot of talent in the space, but I think to be onboarded at Hoag, aside from their functional expertise, I would think that they have to bring to bear kind of that Hoag je ne sais quoi, that Hoag culture. So can you expand upon those intangibles that they might bring to bear?
I can. So you are correct. The resume, the CV is just the ticket to get in.
Yeah.
And have the opportunity to interview or be considered. Once they get there, though, it is really important to find out if they're a good cultural fit, if there's the chemistry, and they're going to have the attributes and the values that really define Hoag. And part of that is this deep commitment to patient care, this deep commitment to being compassionate, a commitment to actually being collaborative. The healthcare team is very broad and it's very complex. And so we need individuals that understand and value the notion of working in a team and being part of a larger ecosystem. But at the end of the day, it's what's in their heart. And usually that gets manifested through comments like the stories that they tell about the care that they provided to a certain patient or in a certain situation. And you begin to really understand, are they a transactionalist? Or do they really have deep passion for the work that they are doing and the people that they're caring for? And it's something that you feel. It's something that, having 30 years in the industry, you just know it when you see it and you feel it. And if it's not there, you they're a great talent. We're happy that they're part of the U.S. healthcare system, but they may not be the right fit for this community and for Hogue.
I'm glad you've shared this, and I like the way you express it, because it's clearly when you see a Hogue physician, a Hogue employee, you can just tell they have that special secret sauce, and they wear the Hogue colors with pride. So well done in that regard. As I think of good governance, and as we share a little bit maybe with our audience, I think about how do you make decisions? How do you allocate significant investments for expansion? So working with that board. So talk a little bit about the relationship with the board, the role of the board from your vantage point, and how we get through things that we might disagree on and working together.
Yep. So it starts with the selection of the board members. We have an attribute-based board. We understand and try to project out what attributes are needed for the organization to be successful in its mission. And then once those attributes are identified, then we go find the best talent, not only in Orange County, but sometimes abroad, that have those attributes, that have a passion for healthcare, have a passion for this community. And then they invite them, and they come join the board, and then they bring that expertise to bear in the various initiatives or strategic plans that the organization has, which we greatly value. So the board is highly involved in so much of the decision making and the planning, and we counsel with the board frequently and use them as I would call them deep advisors on our initiatives. And we also provide a lot of education. So they might bring expertise in legal or development or finance or investment. And what we do is we then teach them the healthcare space. They then teach us their skills, and magic happens.
I think that's perfectly said, because people will ask me, they say, well, how do you make decisions when you don't have the content knowledge of a healthcare expert? And we say, well, that's really brought to us by the administration and the experience. Our job is to bring our life experiences, our business experiences. And do we have disagreements? Yes. But a lot of that is done in more of a discussion and a collaborative way.
That's correct.
So I find it to be a very thoughtful process. I think the committees that we have, that's where the real work gets done, whether it's governance or investments or compensation or quality improvement, whatever it may be, such that by the time it comes to a board meeting, a lot of the discussion has been vetted thoughtfully.
For sure.
So your team does a great job in that, and I think there's a lot of good collaboration between us. So I enjoy the process very much myself. So moving on to maybe a little bit more, we dive a little deeper as we get into kind of the healthcare space. I'm thinking a little bit now about, Orange County residents certainly have a choice when they think about their healthcare options. So I want to have you kind of frame for us, how is Hogue really different to other health systems in Orange County, and maybe even farther afield?
The healthcare space has kind of moved into what I call big healthcare.
Yeah.
Very corporatized, very systems oriented, at scale, a lot of attributes that might describe corporate America. What Hogue has done is kind of gone contrarian to that, where it has remained hyper-focused on Orange County. We consciously and constantly nurture this notion of personalization and compassion. We often say we're not treating patients, which is an industry term. We're treating friends, neighbors, and family.
Yes.
Really trying to keep it at a more intimate, family, personal level. And I think that has separated Hogue in a pretty material way from what people normally experience in today's healthcare environment or the industry.
That's evident in lots of different examples, but you might, in a non-commercialized way, could you share with me, why did they say take me to Hogue? Would help us understand what that means, if you could?
We've always had this deep commitment to being excellent. It's not just in the delivery of the clinical care that we provide and making sure that that is best in class, but it's the experience that they have while they're under our care that really matters and gives them the security and the warmth that people need in their hour of need. And so we nurture both of those, and we expect both of those. And so when people say, take me to Hogue, it's really hey, I feel safe there, and I know I'm going to get excellent quality.
I would love to maybe take it upstream for just a second and understand a little bit more about, I think generally when you talk to people about healthcare, it has a perception issue, especially in the greater U.S. So whether that's the payer side or the confusion about the processes. As a CEO of a very successful healthcare system, how does this perception of healthcare affect your decision-making process?
Right. So there is a challenging perception issue with the U.S. healthcare system, and they do think it's big healthcare, that it's maybe gone too much that way, that it's not as personal or not as warm and difficult and complex. And so we try really hard to make sure that we ease their way through all of those points of challenge or those transition points to make sure that what we're delivering feels very personal and unique to them. And I think that it's a big differentiator for Hogue, and we're going to continue to invest in those, in those systems and processes that make it feel like, hey, this is for you. This is your Hogue. This is your healthcare journey, and we're here to support you in that.
Is there an example of something that we're doing that might stand out in your mind that examples that a little bit?
Yeah, so at least in the hospital industry, it's usually about a 4-day length of stay. That's when you're a guest inside a hospital facility. And but that's not your healthcare journey. Your healthcare journey starts long before that, and it is with you far after you leave the hospital. Hogue at Home is that perfect transition out of the acute phase and continues your recovery or your wellness journey long after you have actually left the walls of the institution. And so it's a perfect transition. It's a beautiful place to continue that wellness and that recovery effort, all with the same clinical team. So you don't have any gaps or starts and stops. You really can achieve some of your best outcomes by virtue of the continuum that's been laid for you.
It's interesting. To me, it's such a great example because you think about the outsourcing of healthcare, the outsourcing of a lot of things today, the decentralization of the hospital environment, right? It strikes me this care at home is just a great example of that. And I'm quite amazed at how successful that has been for Hogue. I mean, is there a sense that you can tie some numbers to that just to help us understand exactly the impact that Hogue at Home is making?
Yeah, so it's only 4 years old. We knew we were have a great opportunity to be successful in this space. In Orange County, there's probably more than 150 home health companies. So when we launched, we thought, hey, this is a place where we can make impact amongst a very fragmented, competitive set. And now we're the number one home health provider in Orange County. We see, or under our care every single day in that platform is about 1,500 patients. We have about 900 that are in our hospice program. And so when you think about all those touch points every single day, not only in the hospital, but out in the community, that's a pretty big footprint.
And the growth of that, I imagine, is just with the demographics of what's taking place in our world today, going to be a big growth engine of sorts for Hogue and for the community's needs.
To be sure.
Yeah. When you think about your legacy, and we think about the work we do today, do you reflect on what someone might say about Robert Braithwaite and how he conducted himself? What would be a statement that you would envision someone saying about your legacy as a leader in healthcare?
I think one of the things I love most about Hogue is this notion of we call it the Hogue family.
Sure.
And so changing the pronoun from an I to a we is really important in our culture.
Yeah.
And so it's not so much what I can do, it's what we can do.
Right.
And so I love that about Hogue, and that is threaded throughout every department within the institution. And so as we look forward and the legacy that we leave, hopefully the next generation, as they look back, would look back and say, you know what, they expanded the services to Hogue to all of Orange County, that Orange County citizens got the best health care that's able to be delivered, and they can all have very easy access within 10 minutes of where they live to Hogue.
Well, we are so fortunate to have you as our CEO and our leader, and leadership matters. So know that you're carrying on that with your team, and I think the legacy is still to be written for you, but it would be an amazing one and something that I'm enjoying being in the front row seat. Robert, thank you. That was great, and I think now we're going to take a walk around of your newest facility here in San Clemente.
Sounds great. Let's do it.
All right, let's do it. Robert, the space shows so well. It's really amazing just how the integration of kind of casualness, health environment it feels. I mean, it's really the new chapter.
Yeah, for sure.
How exciting for you here in San Clemente. I'm walking around here, I think when people think about their doctor's office or healthcare space, they think of something kind of rigid, formal, institutional. I mean, this feels like a health spa. So help us understand this move from conventional healthcare facilities to what you're envisioning here. And then separately, maybe, is this what you're doing throughout your system as we think about Hogue going forward?
When we decided to do this facility down here, we really engaged the community, and we engaged a lot of the moms down here in South Orange County, the CEOs of healthcare.
Yeah, CEOs of healthcare, very good. Yeah.
And we asked them, what do you want as far as a physical facility goes? And so we met with probably 120, 130 moms in in San Clemente. And so they gave great feedback to the design team, and they said, this is what we'd like to see. This makes it feel like it's San Clemente. And so the product you see is what they really chose for their healthcare.
And help us understand what services are provided within this beautiful space.
Yeah, so part of that is going through the analytic process of what do they want, what do they need, what are they going to utilize. So we have obstetric care, we have family practice, primary care, we have urgent care, we have a full diagnostic suite with the best technology available. We have specialty care, various different specialties that are all going to be utilized by this community given their age, their demographics. And so, it's a nice complement brought together for them.
Sure. So why San Clemente? Help us understand why this was a very important foundational piece to the whole Greater Orange County coverage.
Yeah. So 7 or 8 years ago, the city lost a hospital down here. It closed.
Right.
And a lot of the physicians that were in the community that participated in that hospital, they moved north.
Right.
And so the residents down here in deep South Orange County really didn't have access to a lot of physicians or healthcare, if you will. So we call it a healthcare desert. And we saw a need that they were all driving north considerable distances to get to their primary care office or their pediatrician office. And we said, you know what, let's bring healthcare to them. And so that began the journey of Hoag Health Center San Clemente.
And it appears just from being here that you're busier than you could have imagined in terms of just kind of your initial opening. Is that fair to say?
Yeah, the community has really warmly embraced Hogue here, and it's doing very well.
Robert, when I'm walking around, I notice there's some prominent brand names, Garmin, Hyperice. So talk to me about the vision and the utilization of some of these private partnerships and how that's integrated into your growth plans.
Yeah, so the healthcare industry thinks about usually what happens in the exam room.
Right.
The population does not. They think about their healthcare journey far beyond the walls of the exam room. And so when you talk to people and say, hey, what's included in your healthcare journey? Oftentimes they are referencing prominent brands like Hyperice and Garmin, other tools that they use to keep themselves well and healthy.
Sure.
And so we thought, you know what, let's bring them in. Let's bring them in as colleagues and as partners into this space and really meet the need that the patients are telling us that they have and that they want.
Great. Well, let's continue our walk. What do you say?
Great.
Okay, good deal. Wow, this is amazing. Robert, when I'm in this space, I think about the evolution of healthcare. This feels like a workout facility. So it almost is contradictory to what you would be thinking about an enterprise would want to do, because historically hospitals and healthcare centers have taken care of patients and are compensated for that. You're keeping them healthy. So help us reconcile how you're not cannibalizing your income generating activities by keeping people healthy with this wellness thesis.
The model of healthcare historically has been a sick care model. You get sick, we take care of you. However, what really is of interest and what people really want is a health care model. And our mission is to provide the highest quality health care to the communities we serve. So San Clemente is no different than many communities where they're super interested in health and wellness. Right. And so while we're going to do the sick care component of it, we believe to be consistent with our mission, true to our mission, and meet the needs of the community, we have to add that health component to it. And so we do.
It's brilliant. And I think, you'll correct me, but you really capture the customer in their journey through life by providing that side of the service model. And then when they do need some conventional health care, where are they coming, right? You built that relationship.
Yep.
So I think a lot of people misunderstand the hospital and healthcare enterprises, and you'll correct me, but a majority of many are for-profit. I know Hogue is a not-for-profit organization. So maybe color for us a little bit of how that brings an advantage to you as a not-for-profit as you think about your franchise.
You're correct. We are a not-for-profit healthcare organization. What that allows us to do is it allows us to take the resources that Hogue's able to garner from the provision of care and reinvest them back into the overall infrastructure or the community. And so we do that. Versus a for-profit, whatever resources they end up with at the end of paying all of their expenses, they allocate those or distribute those to shareholders.
Sure.
So it allows us to actually invest more aggressively, maintain a leadership position in technology and clinical care, and allows us to candidly be a lot more nimble as we meet the needs of Orange County.
Makes perfect sense. And I know a metric for us is that continued ability to reinvest. It's not an ROI model like a for-profit, where you mentioned stakeholders requiring a certain return to continue to support your mission. You're really tangibly looking at generating a return that allows you to reinvest and keep the enterprise continuing in its existence and its growth.
Yeah, and that's just it. We have to grow. We want to meet more needs in the community and other places. And so for us, it's an engine that fuels growth. It's an engine that allows us to meet the mission more fully. And candidly, instead of ROI and ROA, it's ROH, which is return to health, which is a great.
I like that.
Yeah.
Very good.
Yeah.
So speaking of growth, where might we see Hogue's expansion as we look forward here in Orange County?
Yeah, so our focus right now is on Irvine and South Orange County. It's a core strategy and tactic for Hogue is to meet the needs and give people options to have a Hogue type care in their community. But once we meet that mission, we'll go back and start the migration north.
And I imagine in the early days here of San Clemente, you've been open how long now?
We're about 6 weeks in.
So if the early results are indicative of what this success model looks like here, how are you feeling?
Yeah, very bullish. The community has warmly embraced Hoag Health Center San Clemente in a big way. We were encouraged, but surprised at how well it has been received. The volume of patients that we're able to touch and connect with already in the early days has just been beyond our expectations.
That's wonderful. So as I think about, mobilizing a workforce like you have at Hogue, I mean, how many employees do you have today?
Just under 10,000.
10,000, and you have the new Irvine facility that's expanding, and that will be kind of having its launch here early next year.
That's correct.
So I know Miles Chang, our Chief of Staff, is initiating and leading a program to train young leaders and leaders at Hogue in a lot of different areas other than conventional healthcare practices. So might you color that a little bit to talk a little bit about other leaders helping lead your workforce?
Yeah, so we embrace a lot of the skill sets from other industries, the hotel industry, for example, and really hearing from and learning from them. They have things that they do excellently that we have those same functions just in the healthcare setting that we need to learn from. And so we welcome all those experts to come into our organization, teach us and mentor us, help us become exceptional.
Hospitality within hospital, yeah?
That's right.
So I know that that's an initiative you're pushing to really change the experience for that customer from what they're used to maybe in a healthcare environment.
Absolutely. People want great, high quality care, but they want it in a warm and gracious way.
Robert, this was a real treat. I hope we get to do this again, and I know we will as we learn more about Hogue and the things going on here.
Thank you, Robert. It's been fun.
Thank you very much. Yep.